Question: recognizing patterns of immunodeficiency. A 6-month-old infant is brought to the clinic due to a history of multiple infections. He has had 3 episodes of Streptococcus pneumonia, otitis media, and 1 hospitalization for Haemophilus influenzae pneumonia. Physical exam reveals absent tonsils and small lymph nodes. Flow cytometry shows markedly decreased CD19 plus cells and normal CD3 plus T cells. Which of the following pathogens is this patient most likely to have difficulty clearing due to his immune defect? A. Candida albicans, B. Cytomegalovirus, C. Respiratory syncytial virus, D. Neisseria meningitis, E. Pneumocystis jirovecii. Correct answer D. An explanation. The child has a B-cell deficiency, CD19+, which predisposes him to recurrent bacterial infections, especially by encapsulated organisms like S. pneumoniae, H. influenzae, and meningitis. Neisseria meningitis is an encapsulated bacterium that requires opsonization by antibodies, especially IgG and IgM produced by B cells. Why not the others? A. Candida albicans, fungal, more common in T-cell or neutrophil deficiency. B. CMV, viral, suggests T-cell deficiency. C. RSVs, also a viral pathogen linked to T-cell immunity. E. Pneumocystis jirovecii, fungal, occurs in T-cell immunodeficiency, e.g. HIV. Statistical application in B versus T-cell deficiency. A study aims to evaluate the diagnostic utility of a new lab test that distinguishes between B-cell and T-cell immunodeficiencies in children with recurrent infections. The test has a sensitivity of 95% and a specificity of 90% for identifying B-cell deficiency. In a clinic where the prevalence of B-cell deficiency among immunodeficient children is 60%, what would be the effect on the positive predictive value PPV of the test? A. The PPV would be low due to high sensitivity. B. The PPV would decrease because the specificity is not perfect. C. The PPV would be high because the prevalence is high. D. The PPV would not change because sensitivity and specificity are fixed E. The PPV would be equal to sensitivity. Correct answer C. The PPV would be high because the prevalence is high. Explanation: positive predictive value PPV increases with higher disease prevalence. In this case, 60% prevalence of B-cell deficiency in the clinic means a positive result is more likely to represent a true B-cell deficiency. Why not the others? A. Sensitivity doesn't lower PPV, it affects false negatives. B. While imperfect specificity adds false positives, high prevalence still favors higher PPV. PPV does vary with prevalence. E. PPV sensitivity, they are separate statistical measures. Question 2. Recognizing patterns in diagnostic reasoning. A 4-year-old boy has a history of recurrent otitis media, pneumonia, and sinusitis due to Streptococcus pneumoniae and Haemophilus influenzae. His brother died of similar infections at age 6. Flow cytometry reveals absent CD19 plus cells but normal CD3 plus T cells. A researcher analyzing diagnostic tests for immunodeficiencies notes the test for this condition has a likelihood ratio LR plus of 12 tonsile. What does this LR plus value imply about the test's diagnostic performance? A. The test has low specificity. B. A positive test result strongly suggests disease C. The test cannot distinguish between B and T cell defects. D. The test is primarily useful for screening, not confirmation. E. The test has a high false positive rate. Correct answer, B. A positive test result strongly suggests disease splanation. A positive likelihood ratio, LR plus 10, is considered strong evidence to rule in a disease. An LR plus of 12 means the test is highly useful diagnostically when positive. Why not the others? A. High LR plus suggests high specificity, not low. C. CD19 is specific for B cells. This test distinguishes well. D. LR plus 10 implies confirmation, not just screening. E. High LR plus means low false positive rate, not high.